Peace and blessings, people. Welcome back to the channel. Once again, today we're going to be talking about a topic that is not only near and dear to my heart, because that's how my healing journey started, but it's also very important to billions of people out there in the world because it's the number one risk factor for the number one cause of human death, okay? That being cardiovascular disease, and that number one risk factor is high blood pressure. If you don't have it, somebody who has it, and the statistics show that if you don't have it now, a large majority of people are going to develop it. And so it's very near and dear to me. So I know it's very near and dear to you as well, if not for you, for somebody you love. Now, if you're a current subscriber, thank you so much for your support. If this is your first time to my channel, make sure you go ahead and subscribe. Hit that notification button so you'll get notified whenever content like this comes out in the future. Okay, so without any further ado, let's get started. So my journey started out in terms of like my healing journey. I got diagnosed with high blood pressure when I was actually 16 years old in high school. Okay, this is despite the fact that I was an athlete, only had about 5 to 7% body fat. So I was really fit, and I still got her diagnosed with high blood pressure. Okay, I lived with high blood pressure for over a decade into my late 20s, and I finally decided to do something about it after multiple visits to doctors who were telling me not only did I need to take medications, but I needed to take at least 2 to 3 different medications because my blood pressure was commonly around about 160, 170 over 90, 100, okay? So blood pressure is that top number, which is systolic over diastolic. Systolic is when your heart is contracting. So when you hear that beat, that is the contraction of the heart, okay? And that number is representing the pressure that's in the heart whenever you're in the blood vessels, whenever your heart is contracting, okay? All right. And then the bottom number is when your heart is relaxing, there isn't a B, okay? And so if that number is higher and you're supposed to be relaxing again, the pressure in the blood vessels are higher than it should be. Okay, so mine was routinely 170 over 100, okay, which is approaching stroke level, okay? And so I realized that after working in the hospital and seeing people who are now in their early 30s, and I was at the time in my late 20s who were having heart attacks and strokes, I realized that this was going to be my impending doom at some point. And so I said, you know what? I got to do something about it, and I'll be the first to tell you. Healthcare professionals are probably the worst patients. And what I mean by that is I would get my prescriptions and I wouldn't rarely ever take it, okay? And so I wouldn't take it, and then I wouldn't do anything about changing my lifestyle. So it left me saddle in the same position. So I continue with this sort of back and forth for over a decade now. I'll tell you before we get started into a lot of the things that I did and the recommendations that I give to people. I'll tell you that first, this is a disclaimer. This is not medical advice. This is simply what I did and what I do with people I work with in terms of like giving them things that work for me and that have worked for other people that I work with. So this is not medical advice. This is a holistic approach to living your life such that your body actually heals and rebalances itself. Okay, so this is not medical advice, okay? So, and when I realized, and being a healthcare professional in the hospital, I realized that the vast majority of people who were coming into the hospitals who had heart attacks, who had strokes, many of them were actually on medication when they had the heart attack and they had a stroke. So that also told me that even if I take the medication, like it's helping to reduce my blood pressure, but I still can have a heart attack or stroke. So that even scared me even more. So that was what made me say, all right, I gotta really change my lifestyle, okay? So what I decided to do was go on this healing journey. And that Haley journey consisted of trial and error. I mean, I tried everything. I tried everything from, changing how it worked out, during different types of exercises, CrossFit and HIIT training and aerobics training with Billy Blanks, you name it. I tried that. I tried all different types of diets. And I'll tell you, this is why I discovered diets don't work, because diets don't change your lifestyle. Okay. And so after a lot of trial and error, I finally figured it out. But before I get into what I did, that literally took my blood pressure from 170 over 100 to literally 117 over 80, sometimes some 117, 115 over, 70. Before I share with you what I did with that, let's first dive into a little bit of the statistics behind high blood pressure, because I think it's important to first get informed so you understand what high blood pressure is, because a lot of people do exactly what I did. The doctor tells them that the blood pressure is a little bit high and they brush it off because most of the people in the family have high blood pressure and they see them walking around, no problem. And so in their mind, they're thinking like, well, a little high blood pressure won't kill you. But again, it's the number one risk factor for the number one cause of human death. That's the first thing. The other thing is high blood pressure has a nickname, and that nickname is the silent assassin, okay? Because most people who have high blood pressure don't even know they have high blood pressure. And most people who have a stroke or a heart attack have a stroke or a heart attack without even knowing they have high blood pressure, okay? So this is why it's so important to first get informed, okay? So first sort of statistic that's really important to understand is 1 in 4 adults between the ages of 40 and 20, I would say 20 to 44 have high blood pressure, 1 in 4. Okay, that's 1 in 4 adults. And if you start to get into age brackets that are between 40 and 50, and then between 50 and 60, that number goes up exponentially. Okay, so that's really important. If you walk into a room now and the room is filled with people between the ages of 20 and 44, 1 out of 4 people, 25% of the people are going to have high blood pressure, and most aren't going to know it. The other thing that's really important is high blood pressure isn't just this thing you can brush off. Let me give you a few examples of what high blood pressure is doing to you, all right? I'll first start with what should have been telltale signs to me, even at 16 years old, that something was wrong with my blood pressure. I would notice that I would get headaches, okay? I was noticing that I was getting more fatigued than usual. Okay, I was noticing that I was getting that headache in a particular area of my head as well too. So those are some of the things that were telling me that it was high blood pressure even before I got diagnosed. The other thing that's really important, as I mentioned before, is that, high blood pressure isn't just PL pressure. That's high and the body is not doing anything, okay? High blood pressure stiffens the blood vessels. It makes the blood vessels more stiff instead of being more elastic and movable. And just think about it. If you had a tire on a car and that tire got very, very stiff, it would at some point crack, okay? And when it begins to crack now, you lose all the pressure, okay? You can have a heart attack, you can have a stroke, etc., okay? All right, the other thing that's really important about having high blood pressure is that it promotes the buildup of plaque in the arteries, okay? Not plaque on the teeth, but plaque in the arteries, okay? And that plaque can eventually break away from the walls of the arteries and block off that artery or blood vessel, and that will lead to you having a heart attack, okay? That can potentially even lead to you having a stroke, okay? So having high blood pressure increases plaque inside of the arteries as well too. And then the other thing is, it again isn't the leading cause of strokes, it's a leading cause of heart attacks, okay? So it's not something you can just walk off. The other thing that's really important about high blood pressure, it ruins your kidneys, okay? Because again, when you have high blood pressure, it's not just in the heart, it's everywhere in your body, and particularly in the organs is where it's most dangerous. Think about the kidneys, okay? The kidneys will have high blood pressure in the kidneys, inside of the vessels inside of the kidneys as well too. And that will lead to the kidneys beginning to break down, which is really important. So high blood pressure ruins the kidneys, which causes you to develop cardiovascular disease. Your kidney that's the big point that I want to sort of make to you guys, is that everything is connected, okay? It's not just ruining your heart. It's not just ruining your blood vessels, just ruining your kidneys. It's ruining your brains, okay? It's ruining, the flow of blood throughout the entire body, Okay. So it's really important that everything is connected. Okay. So once your kidneys get ruined by the high blood pressure, it's going to affect your heart and cause you to eventually have cardiovascular disease. And as we can see, especially in our community, in the Black and brown community, you can see that kidney disease is going up exponentially every day. Okay. We're starting to see dialysis clinics in our neighborhoods to the same tune of McDonald's. We see as just as many dialysis planets as McDonald's. And that makes sense now, right? When you're eating that type of food, okay, it's going to ruin your kidneys. And we'll talk about why that happens when you're eating that type of food, why it ruins your kidneys and raises your blood pressure in just a moment. The other thing is high blood pressure, according to the World Health Organization, is also considered the number one contributor to all causes of mortality. Okay. The number one, if they were to rank what things contribute to mortality or death, high blood pressure is the number one contributor. Okay. So again, that's why it's so important. The other thing this is probably something that most people don't know, but when I found out this statistic, it really changed everything for me. The leading cause of death for cardiologists, which is a heart doctor, the leading cause of death for heart doctor is cardiovascular disease. Now imagine that, they go to school for 12, 14 years, residency, like all of these things and put in all of this work. And they're expert at the heart and the number one cause of death for a cardiologist, cardiovascular disease. Okay. Now that doesn't mean that they don't know anything about the heart, but that definitely means that as a group, as a whole, they don't know much about healing the heart. Okay. So it's really important for us to understand that. And if you look at doctors like Dr. Dean Ornish, who put us multiple studies in multiple peer-reviewed journals, very respected journals and publications, he literally has been doing things with the whole foods, plant-based diet to heal people of not only high blood pressure, but even congestive heart failure and other cardiovascular diseases. So it's really important we get those statistics out of the way first. And then let's go into some risk factors, things that actually cause, your blood pressure to be high. Okay. So some of those risk factors would be being overweight or obese. So the more adipose tissue you have on the body, the higher your blood pressure. The other thing is a sedentary lifestyle, okay? The less you move, and the reason why this is so important, because today we move much less than our ancestors. Our ancestors walked to work. Our ancestors, most of the jobs were actually manual labor jobs. And not only that, most of them were manual labor jobs that were outside. Okay. So our ancestors, our great-grandparents, our grandparents were much more better at movement. Okay. And we have a much more sedentary lifestyle compared to our grandparents. I mean, everything has changed in the last 50 years, and we'll dive a little bit deeper into that. But a sedentary lifestyle will increase your blood pressure as well, because life is about movement. I mean, circulating blood through your body is a constant thing, is happening right now as we speak. And the less you move, the less you circulate. Okay. And that is true because the lower half of our body doesn't have a pump like the top half of our body. A top half has a heart that is pumping the blood. The bottom half doesn't have a pump. So if you don't move, you don't get that blood flowing back up through the veins. Okay. So it's important to have movement. Okay. Other things, the standard American diet, will dive into that a little bit deeper. But the standard American diet is 60 to 70% processed foods. And that processing comes with food chemicals. And a large majority of those food chemicals are things like salt. Okay. Not the salt you use with the shaker, but they're putting salt in it to preserve it. Okay. And most people don't know how to read food labels, so they don't even know how much salt is in it. Okay. And most people eat so much processed food, they're not actually adding it all up throughout the day. So they don't know how much salt they're consuming throughout the day as well, too. And we'll dive a little bit deeper than that, because most people think when you have high blood pressure, it's always attached to you. Having too much salt in your diet, that's not always the case. The other thing is drinking too much alcohol, stress, taking a lot of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, okay? These are like things you can buy over the counter. Advil, ibuprofen, Motrin, naproxen. These are often painkillers that people are using. People use them commonly, like I know people who use them daily, if not every other day. And these things will raise your blood pressure, not only raise your blood pressure, but also kill the good bacteria in your gut. With some of that good bacteria is actually there to help monitor your blood pressure to keep your blood pressure normal. Okay, so that's really important too. Low vitamin D, and roughly 70% of African Americans and people of color have low vitamin D or at least suboptimal levels, okay? And vitamin D plays a key role in converting an enzyme into kidneys, okay? Because when you get vitamin D, it hits the skin as they have magnesium to convert it there. It then has to go through the liver to be converted. That sunlight, when it hits the skin, goes to the liver to be converted. Then it has to go through the kidneys to be converted. And now you have vitamin D active, the active form of vitamin D, where if you don't have healthy kidneys, as I mentioned before, now you can't convert this, sunlight into vitamin D, the active form. Okay, so you can see how having low vitamin D and you won't have this enzyme. Now you're going to have high blood pressure because now it's going to start to affect your kidneys as well too. Okay, dysbiosis. And that's what I just mentioned before. Dysbiosis is having a lot of bad bacteria in the gut and not enough good. Okay, so having dysbiosis in the gut can cause your blood pressure to be high. Also, kidney issues, as I mentioned before, one in three patients in the U.S. Have kidney disease. Okay, and that's 1 in 3 African Americans have kidney disease. That's about 33. So we got 3 people here. One of them are who are African American. One of them are going to have some form of kidney disease. And that is crazy when you think about the fact that African Americans only represent about 12% of the American population. Okay, but we represent 33% of kidney disease. Like, that's crazy. So we got to do something. All right. So let's jump into some things that we need to eliminate. What do we need to eliminate? All right, you got to eliminate things that are causing stimulation to the body. Things like caffeine coffee, okay? That will increase your heart rate, which will increase your blood pressure. So eliminate, and not only that, coffee will also be dehydrating to you, and dehydration will dehydrate the kidneys, put more pressure on the kidneys, increase the blood pressure in the body. Okay, so getting rid of dehydrating and stimulating beverages like coffee and caffeinated, drinks like energy drinks. Okay, getting rid of processed foods. As I mentioned before, processed foods, relatively a new thing. They didn't really come into play into like the 1950s after World War II, when, they were using scientists to create processed foods for the soldiers who were fighting. Because one of the big things about wars that they knew was that a lot of the soldiers died not from, being shot, stabbed, or killed. They were dying as a result of malnutrition. Okay, so they created a lot of these processed foods so that when they dropped them, they would last long enough. Okay, and then they sold that or gave that information to the food industry, and then you had this big boom, processed foods. But ever since that time, the 1950s, you have seen an increase in cardiovascular disease. That's when you saw cardiovascular disease become the #1 cause of death in the US, and then later on become the #1 cause of death for human being in general around the world. Okay, and you can go that if it has 200 milligrams, it means that you now have consumed 1,000 milligrams. And that's just one thing. We're not going to talk about all the other foods you consume. So read your labels. Number 2, eat foods that are high in potassium. Remember what I said, foods that are high in potassium. The good thing about those foods is potassium lowers the blood pressure because it relaxes the blood vessels. Okay, so foods that are high in potassium that are not bananas. Okay, avocado, and avocado has about 700 milligrams in one avocado, 700 milligrams of potassium. Okay. Dried apricots. Okay. A good 2 coconut water. Good 1 cup of coconut water has 600 milligrams of potassium. So you have some coconut water, 1 cup of coconut oil, you have some avocado. You're almost there, all right? Watermelon, okay? 2 wedges of watermelon. You'll get a sufficient amount of potassium as well, too. Butternut squash is also a good one as well, too. So get your potassium from Whole Foods, as I just mentioned, okay? Not the supermarket, but Whole Foods, okay? Number 3, adopt the Whole Foods plant-based lifestyle. I'm telling you what I did on my journey. So I started eating a lot of high potassium foods. I started reading my labels. I adopted a Whole Foods plant-based lifestyle. I said, I'm going to not just eat vegan. I'm going to eat whole foods, not vegan. Junk food, whole foods for 60 days. That's what I told myself. Okay, I did it for 60 days, okay? And I'll tell you, my blood pressure changed too. I started doing a lot of exercise twice a day, and most of the exercise I did at home or in my neighborhood, okay? So when I said exercise, I mean movement. You can do jumping jacks at home, you can do push-ups at home, you could do lunges at home. You can sit down and up and down in a chair at home. I did a lot of movement, and whenever I did like aerobic activity, like running or jogging or walking, I did it within my target heart rate, okay? But then my target heart rate, which really helps, by the way, number 5, meditation, okay? Because again, high blood pressure is really an issue of stress in the body, okay? It's pressure, okay? So I did the meditation 2 to 3 times a day because meditation is known to soothe the nervous system, particularly the sympathetic nervous system that I talked about earlier. Okay, number 6, stay super hydrated. I was drinking half my body weight in ounces, okay? So I weigh about 2 to 15, okay? I'm about 6'2", so I drew a half my body weight in ounces. So I was drinking somewhere around 4 liters a day of water, okay? Coconut water, green juices, things of that nature, okay? So stay super hydrated. The more hydration you have, the more you're gonna keep the kidneys healthy, okay? And then last thing, and probably the most important thing that I did was cleansing and detoxification to get all of that salt that I have been consuming since a child, all that salt from the processed foods, because most of the things that I grew up on came in a box bag canned jar, and they're preserved by salt, that preserved by food chemicals, okay? So doing cleansing detoxification, this is where I created my detox. So for those of you who know, I have a 14-day and 28-day detox, full body detox. It gets rid of yeast parasites, gets rid of all the waste in the guts and in the gut, and a lot of the food, chemicals, heavy metals, mucus, things of that nature. I created my detox during this time, and my blood pressure went literally from 170 over 100 on average to around about 117, 115 over like 70 to 80. Okay, so I hope you guys have enjoyed this. I know it was a little long today, but I had a lot to share in a very small amount of time. So I hope you've enjoyed this. I hope it gave you a lot of aha moments, and I hope something on here will help you transform your health. Again, if you love the content, continue to follow, share, make sure you subscribe if you haven't, and I'll see you in the next video. Peace.